Good evening. Welcome to the March 11th Commission on Disabilities meeting. Just like to welcome everyone. I'm hoping that Revere TV is live streaming and broadcasting this. I just don't see it on the local access TV channel, so hopefully it is up and running. I just want to do the start with the Pledge of Allegiance and my trusty little flag here. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Our vice chair, Pauline Pernell, is going to be a few minutes late, so I will take the attendance right now. Excuse me. Myself, Dr. Chico, the chair, is present. Jason Barone. Just going to ask you to unmute and just if you could say if you're present, please, Jason. Jason.
Yep.
Thank you. Thank you. And I'll just remute you. Mario Gramanis.
Present.
Ellie Vargas.
Present.
Anne Marie Fiore.
Present.
And once Pauline comes in, I will mark her presence. Like I said, she's just going to be a few minutes late. She was stuck in traffic commuting back from an appointment. Okay, so as everyone received the emails on Friday, I had sent out the agenda for tonight along with the meeting notes from our February meeting. So if everybody was able to check it over, if there's anything incorrect, please let me know. If not, if I could have a motion to approve.
Motion.
Motion to approve by Mario in a second.
Second it.
All right, so moved. Okay, and approved. Okay, item number 2 is updates, next steps from our February 11th meeting. We had, if there's any updates from Pauline and Anne Marie regarding the calendar for future monthly guest speakers. I know Pauline was still waiting to hear back. She has 3 people and agencies that still have not responded back with dates that they were available to come. So needless to say, that's why we do not have a guest speaker again for this month's meeting. So I don't know if Anne Marie, if anybody's gotten back to you or if any other members know of anyone to join one of our monthly meetings. I know it seems
I
like
reached out to a business in Wakefield, but I'm still awaiting a reply.
Okay, appreciate it. Okay, just update me. I won't bother you, but if they do get back to you, just let me know. You know, our meetings are the second Tuesday, so if they do, right now we have our April meeting is open. We don't have any guest speakers for the April meeting, so if they're available, let me know, and then we can coincide with Pauline if she has anybody for the future month's meeting, or we can go from there. Just as an update, the second item for updates and next steps regarding letter sent to Representative Turco regarding the Revere Beach crossing safety. I had sent that out the day after our February 11th meeting. So it was emailed to Representative Turco, but I did not get any response back. So I just wanted to update you. But if I do hear anything, I will let the commission know at our next month's meeting. So I just wanted to update you on that. And then the third item is the update to the music therapy program in collaboration with Revere Parks and Recreation Department, which is going to be item number 3, which is the next item that we will discuss. So what I will do is I'll just move right on to item number 3, since that is what it is, and discussions regarding the Community Music Center Boston proposal. We had an informal meeting with Jen Duggan from Revere Parks and Recreation. and they are very amenable to partnering with us to offer the programming, the workshops, the start of the workshops, so that they were going to be having a meeting with the Community Music Center Boston. I believe that was going to happen, I believe, yesterday. And then they were going to let me know what the outcome of that meeting was, to see what the next steps were. Logistically, there has to be a lot of background paperwork that needs to be done to get them set up as a vendor, figure out dates and space availability through the rec center that coincides with 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 both of their agencies, to make sure that it works okay. I just was notified by Revere TV that we're all set and up and running and live streaming. So thank you, Revere TV, for that. I appreciate it. Um, it looks like we're moving ahead with that music therapy program for the 3 workshops. I don't know if Anne Marie, if you wanted to add anything on that, because you were with the discussions with Parks and Recs, and they do seem that they are very willing to be a partner with us, and they are taking it to the next steps with the Community Music Center of Boston.
Yeah, it's exciting. It sounds like it's going to actually happen, which is really exciting after all of these months coming to fruition. My only thoughts were on our behalf, or if there's anything we can think of or that we can do to kind of outreach to let residents in the city know that it's happening. Can we reach out to Julie Brown, to CPAC, to the schools, to let them know that this is happening?
Yeah, once it's solidified with Revere Parks and Recs, getting the back end of it done, getting them on board as a vendor, and they get the dates, then we will get that information, and then we can notify Julie Brown, CPAC. We can get it on the City of Revere's calendar on their website, and we can outreach to wherever necessary. And Revere Parks and Recs will also put it on their website and do all that outreach. So it's just a matter of us getting the dates. And that's why I was saying it's better if we can move this into April. It gives us some time, and hopefully we'll have a couple of weeks of publicizing this once we have the dates and whatnot. So it's just a matter of getting all the logistics and all the paperwork and everything done. So hopefully within the next day or two, I will get notified on how that meeting went yesterday between both the Revere Rec and Boston Community Music Center. And I'm sure they'll be sending me an email and letting me know, and then I will be sure to let everyone know how that goes, so that we can do outreach and go from there on that.
Sounds great. Great.
Yeah. I don't know if anyone has any questions or concerns on that. Just as a point of information, it's a music therapy program. It's not them teaching instruments. It's basically a therapy program. We just wanted to put that back out there. It's not that they're going to be teaching students of all abilities, mostly students, young adults, and children with disabilities. Just different therapy programs for them. And the workshops are going to basically be for their parents and caregivers, to let them know what the expectations is and what the program will be about. Because that's, if Anne Marie, if you want to add anything more to that, because I know you've had a lot of talks with Boston Music Center, more than I have. So I gave a basic summation, but if there's any more you want to add to that, please feel free to.
No, I think you've pretty much touched on, the workshops and then the actual therapy classes that are happening. I don't know that we've necessarily have like a cap on the age range. So if it's
Right.
like young children, teenagers, young adults, I think it's open to all. And then based off of who we get by age range, then the community center will break up the
Okay.
classes accordingly. It seems like, so if we need to have multiple classes after the workshop because we have a lot of young kids and a lot of young adults, they'll be willing to break up to class size to accommodate.
Yep. And we're gonna cap it, I believe, once after the workshops, when we see we have, it's gonna be a cap of, I believe that they want to try and keep it at under 15.
That's right.
If I remember correctly from our initial calls with them, it's better to keep it under 15, 15 people per music therapy class. But what, like I said, what we're gonna do is once we see what the demand is for it, then we will have, hopefully we'll be able to have more than one session. Session's not going to be just one class. We'll sit down with Boston Music Therapy Program, and we'll basically uh, go by what they suggest each session, how many weeks each session should be, and then we will do it. I'm hoping that we can do this seasonal or whatever we decide that we want to do, so that we can offer it more than just one time a year. And if we have to do it in different age brackets, what they suggest that we do it, but we'll know once we have the workshops and what we have for an inquiry of people that want to be participating in it.
Yes, yep.
All right, perfect. So does anyone have any questions or concerns on that? It looks like that more than likely, I'm thinking that this may be taking place either at the rec center, depending upon the time and the availability, or at the Garfield Community Center. The Garfield, when we had initial talks with Parks and Recs, they're thinking possibly the Garfield Community Center, depending on the timing of it, because they think they have a perfect space that could be utilized for something like this. So, like I said, we'll know more when we get specific dates
Yeah,
and
and we
time.
can save the water. Thank you.
All right. So next, I'm going to go on to item number 4, which is CODA, which is the Commission on Disabilities Alliance meeting, which was on Wednesday, March 5th. I'm not sure if Ellie, if you were there for that, weren't you? 'Cause I can't remember.
I was there for a little bit.
Okay. Okay. All right. So I'm just going to go over a couple of things that were mentioned on that. DPC, which is the Disability Policy Consortium, who is the agency that helps run those CODA meetings, mentioned that they have released their 2025 advocacy agenda, which can be found on their website. They also mentioned and sent out emails along with, I believe the Boston Independent Living Center has also sent out emails on this regarding CCA, which is the Commonwealth Care Alliance, has faced some challenging financial issues. And it's an agency that the disability community relies on heavily. So DPC has asked the state to take them into a receivership because of how many people rely on them, and because of the financial issues that they're having. They do not want to see this agency go by the wayside, and then all these people are stranded with nothing. I'm not sure if any of our members know anything about CCA or have CCA and want to talk on that. But I'll open it up to any of our members. But I just wanted to let that be mentioned. Jason, are you aware of CCA at all? We'll take that as no. Allie, do you know anything of CCA? I know you do a lot of advocacy. I seen you went off mute, Ellie, but I'm not sure if you do.
Okay, you talking to me? I thought you were talking to someone else.
Yeah.
Yes, I'm with CCA as my main insurance.
Okay, so you're with them, so you know the troubles, and you've been made aware of that they've been asked to be taken into receivership from the state.
Yeah, there's a lot of stuff going on. Like, it took me about 5 months to get a case manager.
Okay.
So joined up in September, and I just got one like maybe 2 weeks ago. And I've been hearing from the grapevine from other organizations and nonprofits that they are dropping the ball and it's really ticking off the state, especially in the federal area.
Yeah. Okay. So that's why I just wanted to make people be aware of that. So that's why I figured that would be a great thing to mention that we discussed that.
That's one of the concerns I have, Ralph, with it is with a company such as that, because it is uh, a part of the C class of the insurers of Medicare. This is exactly what I get afraid of, and this is what you run into. Uh, Now, let's say Ellie decides to get off. The problem may be, like other people, what you have to do then to get other plans to help you is you have to then fill out forms and may or may not medically qualify. So that's another concern. So I want to put that out there because it ties into that is, some real concerns. But I can't say I'm surprised either. I mean,
If it's a receivership, though, wouldn't that be a benefit, though, if the state takes it over? So financially, it'd be fiscally sound.
could be, but it could also hurt. I mean, it all depends on the solvency and what they can come up with.
Yeah, I
You
know.
know,
I know both DPC and Boston Center for Independent Living are heavily involved.
well, I'm glad to hear that. I hope it puts some peace for people that are on it, but this is one of the reasons why I don't go on those C plans. This
Yeah.
is a concern. Yeah.
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 Just to piggyback off of that, I got it because I went on my mom's retirement, which screwed up my social security and yada yada yada. The only positive thing about CCA is for example, I have the flu. I've been in bed all day. I call them up. They sent a paramedic unit. They're usually the staff is really really kind and they're understanding. I'm really ashamed that they're dropping the ball. I wouldn't agree the federal should take it over. Maybe have a checks and balances, have them being supervised with people. But yes,
It would be state. It wouldn't be federal. State
okay.
will put it in.
I'm just
Yeah.
concerned now with the wave of what's going on everywhere. I
Yeah.
like that, but they need to have checks and balances so they don't
Yeah.
drop the ball. And everyone should have the care they need. Doesn't
Yeah.
matter about pre-existing condition or whatever. But yes, I've been seeing that, and I will contact PPC to see if I can get anything. Uh,
Yeah, you can contact them or the Boston Independent Living Center. But if I'm not mistaken, when something's taken into receivership, they automatically find not necessarily the state, but they'll find somebody to take over that agency, somebody independent, to take over. It wouldn't be necessarily the state. So they'll find somebody to be a moderator and take over that agency. So
yeah, if
that's what.
it affects the staff and what
Yeah.
they already have going well, because they have a good amount of on call nurses, doctors, and behavioral health team. I use
Mhm.
all their services, but
Yeah.
what we already experienced, they having a lot of bad issues as well. So hopefully
Yeah.
we can correct that.
Yeah. Okay. Great. Great. Well, hopefully something good will come about it. Um, the next item was that DPC mentions that they are also evaluating how they will support advocacy with their state and local partners on the federal level. Because there's a lot of people there's a lot of information out there about federal problems with federal programs and whatnot. I just want to reiterate whatever's happening on the federal level. Um, as I always tell people, you're lucky that we're in Massachusetts. Massachusetts, we are one of the better states, and we have a lot of programs are funded through the state. So not that it's gonna put everybody at ease, but a lot of programs that the state has are funded through the state, and not only, and then they don't rely on federal money. So please just realize that the state of Massachusetts is in a lot better position than other states in the U.S.
I agree with that. Yeah.
So please don't panic before you have to panic, and don't always listen to the news. So just take one day at a time.
Yeah,
Um,
what I usually do is YouTube snippets because if you watch news too much, you get depressed.
exactly, exactly. The next thing was the Newburyport Commission on Disabilities. They gave a brief update on a program that they mentioned before that they're in the middle of implementing, which is the Project Lifesaver. I believe I updated the commission on that a few meetings ago. They're in the process right now for their police department. Will begin the training soon on that. So I believe I had sent everybody the information. It's called Project Lifesaver, and I believe you can look it up, Google search Project Lifesaver, and you can find information on that. But they're in the stages now that the police department is going to begin the training on that. Next that I have is item 5 was commission members late informational items. Anything that doesn't have to be discussed or voted on. We can, anything that any public announcements or any informational messages. I'm not sure if any commission members have anything. I'll let any commission members go first, and then I will make an announcement that I have. So open it up. I'll start with whoever has anything and wants to go, please let me know.
I just gotta say is last Monday I went to the Capitol with the what is it press meeting of hands off of housing. They tried to send a letter from the commission on housing to HUD to the new director, and they denied access and had cops remove them from the building. I was there for 2 hours. It was amazing. If you look it up on the internet, you can find it. But it was amazing. There was about 150 people there, and there was a bunch of nonprofit organization and a lot of federal employees.
Thank you. Thank you for going and doing that. Anyone else? All right. So I will make a nice announcement that I have. Um, I was um, I was sent an email the other day with some great news. Um, as you know, I applied again for a grant um, and received an acceptance award notice from Save the Harbor, Save the Bay Better Beaches program, which is the grant that we were able to run the All Abilities Day Out at Revere Beach last year. In this email that they had sent me an award letter, there were 168 organizations and individuals that applied this year for it, which is more than they've gotten. We were one of the 75 organizations and individuals that were awarded the grant again.
Amazing.
Last year we were awarded $3,500. This year, happy to say we were awarded $5,000. So what that means is we need to put on a bigger, better, and more exciting all abilities day out at Revere Beach this year. So I'm going to need input and help from everyone this year. I'm going to do exactly what we did last year and look for more things to add. Try and get some other vendors if we have to pay for other vendors or other amenities to be there. I'm going to look for ideas and anyone else to let me know so that we could have that there. I have to now apply for the DCR permit. But I did the letter of memorandum to them already, accepting the grant. So I think that's great news that we were awarded the grant again with an increase because I had asked for a little bit more money because I wanted to be able to increase the program since last year was the first year and be able to see what we can do to make it bigger and better since this will be the second year. So I'm going to need ideas and help from everybody on the commission. And I'm hoping this year that we can get a better location, hopefully the location I originally wanted last year to put this on. And um, Ellie, I'm gonna need you to go knock on somebody's door that we will talk offline.
Yeah,
Um,
yeah, like I was gonna say, Ralph, call me because I was there in person and I know how it was, and I want to give throw some ideas. And whoever
yes,
I need to visit, wink, wink, I will definitely do it because we need
yes,
more
we definitely
exposure
need to do this.
to safety there.
And because I was the other reason why I want it in the other location is for, people with mobility issues. It's be much easier for them to access it. Like yourself, you've seen that you couldn't get to where we wanted you to get because of how the entrance is to get there. You couldn't get down to the tables or anything like that. So
Mhm.
we need to have it in a better area so that we can really set it up better and have the mats getting right to where our tables are, tables in front of that so we can have everything there. So that's what I want to do. And I'm looking for any help, any ideas, and I really would appreciate it if we can have all our commission members there. So I have to, what I have to do is send a tentative date to DCR, make sure that date is open for the beach to do it. But it looks like tentatively it is going to be in August. I have to give them 3 dates. And I want to work around a couple of big events that I know are happening in Revere, so we're not on the same date. So it's not going to be it's not going to interfere with the Sandcastles. It's not going to interfere with Railroad to Revere. So I looked what those dates are. So tentatively, this is just a tentative date that I'm looking at the second Saturday in August, but this is just tentative right now. Um, that we'll have to see if that date is available. But that's what I'm looking to do because that date does not look to coincide with any of those other two big events.
Awesome.
Um,
A question on
so
that, Ralph, though. It a sandcastle, for example, that gets a lot of attention.
yeah,
Wouldn't
but we
that?
don't. Yeah, but they will not. If there's a big event down there, you
Yep,
can't have an event there.
got it. So they don't want to,
Because
even though we
yeah,
get more attendance and awareness, because the purpose is education under disabilities. So
yeah,
my thought, and that's because they get so many, it might, you
yeah,
know,
and the other problem is too is because of an event like ours, we need to, especially if people are coming in van accessible mobility and vans that are
yep,
accessible, they're going to need to park right in front of the area that we're having it. And events like the sandcastles or things like that, the beach is closed.
right.
And then
Yep.
there's you know what I'm saying? So we have to take that into account, and things of that nature.
Ralph, I was wondering, is it a possibility? I don't know if it is, but maybe get like I would volunteer during the sandcastles if we had like a booth or something to spread the word about, the Commission on Disability, yada yada yada, and connect with other local programs. I just thought of it. It's
We
just an
could,
idea.
we could. I've done it for a few events myself before. We haven't gotten a lot of traction, because when you do it, there's like you can we can reach out to the Rare Beach Partnership. Um, the thing with the sandcastles is that you having people coming from all over the place.
Mm-hmm.
It's not local. Um, so we want to try and do events that are for the community, like any community events you want to see about tabling at, like when they're as a suggestion, like farmers markets or things like that that the community has, or I'm trying to think, they once in a while they run some health fairs at the high school, table and events there, things like
Yeah,
that.
or the church. Or I remember there was a couple times church was doing public events at the beach. So
Yeah,
maybe offline you could tell me what type of events, and if I have free, I don't mind sitting behind a table supporting our
yeah,
organization.
yeah, definitely, definitely. No, that's definitely that could be that could work. So I didn't know if anybody else wanted to comment on that, but please think of activities and things that we could bring to this event to make it a bigger event. And if anybody knows anybody in radio, TV, ways to publicize it, anything
Okay.
like that, except for we publicize it in the local media. We publicize it through the rec center. We publicize it through the city website, through the mayor's office. Emails go out through the city of Revere's office. So if there's any other ways that we can publicize it, I'm always willing to take any suggestions, or if anybody knows anyone at the local TV, at the TV stations or anything like that,
Okay.
because we really want to hype this up. I'm actually going to talk to the Winthrop Commission on Disabilities. They had a very large event last year, I believe, at Belle Isle Marsh. So I want to talk to them about what type of vendors they brought in and paid, and see if any of those type of vendors we could bring into our beach event, if it's something that we can bring to the beach. Also want to see how they publicized it, to get some suggestions on that. So anybody knows anyone or any ideas, please feel free to reach out to them and then reach out to me. You can find costs or whatever you did, and then we can take it from there.
Did
So
you
you
ever?
have the solid dates yet? You're just talking about maybe the August, but like that's not like definite the dates yet, right?
Yeah, right
But
now
to change.
tentatively the date that I'm targeting is the second Saturday in August. Let me take a look. I have to give them three dates, and I believe I gave them August 9th, August 2nd, and I can't remember, and I think maybe August 16th. I can't remember the third date. I'd have to look at the letter that I filled out, because I can't remember if Roro to Revere was the 16th or the 23rd. And I think that the Sandcastles is usually um is sometime before the third weekend of July, either the third, the second, or the first weekend in July. So I wanted to stay away from those because I looked on their website and the date wasn't set yet. So I wanted to tentatively stay away from those dates right now. But I want to do it on a Saturday. You don't want to do it during the week. You don't want to do it on a Sunday, because usually Sunday is more of a family day. And it's be tough for people to come on a Sunday, whereas Saturday is a day that people do like to go to the beach. And we did have some families that came from far away last year, and Saturday was a good day for them, because usually Sundays people if they're coming from far away, there's a lot of traffic on Sundays going back home, so Sundays is not that convenient for them. So that's why I'm looking at. But once I send in my application to DCI with the exact three dates, I will let everybody know. But I know I am shooting for. I really want to have it the second Saturday in August, the 9th.
You should.
That I'd like to have.
You should definitely try, Ralph. Contact 7 News, since they do a lot of things like that, and the family is into those things. It may very well help. I mean, they literally are into so many events. They would love something like that. That's how they were. That's how he grew up and how he ran his business. So knowing that, I think
Who's
you might
that?
know. 7 News, Anson family. That's how Best Buddies got to where it is, because of what they did and all their donations and stuff. That's how they are. That's how they operated even in South Florida. He owned 2 stations before he passed away with COVID, unfortunately. They were always like that. They used to be NBC stations, and then they became independent. That's how he got known. For news. But one of their things that they're known for doing, they have an Anson Family Foundation, and they do a lot of things, and his kids are still keeping it. And so the reason I'm saying that they love this kind of stuff and like to publicize it and do things about it, because they like to put positive things out there. So I think you might have a real shot at getting them to, and they have a huge viewing area. So it will, including South Florida. So you never know, because they have 2 stations, you never know what'll happen. And it might.
How good we're trying to reach out to them once we have a date.
Yeah, exactly. And I would definitely, I think they'll
Would you
wanna
be able to
promote-
reach out to them?
I can try once you have a
Okay.
date. I
Let
mean,
me-
I
yeah,
can,
give
but I
me-
mean, I know coming from you, it's probably going to be a little different than coming from me. But you know,
Yeah.
since you're the commission head, you know that may as a chair. So I'll be happy to try. But I figure it's worth a try.
Yeah, well, you can send a reach out and have them contact me. But once I get the date solidified, then we could try that. Yeah, definitely.
I agree. If we have more hands spreading the word, the better.
Exactly. Because this is, even though it's in Revere, we want this. We would love this to be regional, like the one in East Boston, the one that they do at East Boston at Constitution Beach. It's not just for residents in East Boston. It's actually done by an agency in Malden that uses Constitution Beach, and it's from people from all over that go to the one that's run at Constitution Beach. So that's like that was my goal. I know last year was a little quieter, but it was the first year, but I really want this to expand. So, all right. So, did anybody have anything else that they wanted to talk on that, or any other informational? With there none on that, just going to go to item number 6 was residents' concerns or issues. I just wanted to let everyone know that the Commission on Disabilities phone voicemail is fixed. So voicemails can now be left. It's now back in working. So you can leave a voicemail and we will get back to you. There was a little bit of issue, but thanks to the Revere City Hall IT department, they helped me get that issue corrected. So that is now all set, and it's been up and running since right after our last commission meeting. I got that taken care of. So I don't have any residents' concerns or issues that anyone wanted me to speak about. Next steps is I will continue working on filing any paperwork that I need for this Save the Harbor, Save the Bay, Better Beach grants. I'm not sure. I know that paperwork needs to be submitted to DCR by April, but I'm not sure when they're going to let me know what date, if my date that I picked is fine with them. But I will keep everybody updated on that. So I'll just keep that as a next step, just any updates on that grant program. We'll also, any updates on the music therapy program collaboration with Revere Parks and Recs will be kept as an update for next meeting, and the usual updates from Pauline and Anne Marie regarding the calendar for future monthly guests. And lastly, any updates regarding the letter that was sent about the Revere Beach crossing safety. So I'll keep those items right on there for next steps. Item number 8 is our reminder. Pauline must have really got stuck in traffic. She must be stuck coming down Route 1. So I will read the reminder. The Commission on Disabilities office number is 781-286-8267. Residents can also call Revere 311 directly and speak to their staff Monday through Friday. They will answer most questions, but if they cannot, or if you want to talk to our department directly, ask to be transferred to the Disabilities office phone number. Please leave a detailed message and someone will get back to you soon. As always, don't hesitate to contact us if you want something discussed or added to our monthly meeting agenda. You can also let us know if you want to discuss any concerns. The Commission is here to help and assist all of the disabled residents and families of Revere. Can I have a motion to adjourn?
Motion to adjourn.
And a second?
Do you want me a second? Or
Did
you don't want to adjourn?
somebody second it?
They're asking to adjourn.
Anne Marie seconded it. Okay. Second. And our next meeting will be on Tuesday, April 8th at 6 p.m. Thank you as always. And I always appreciate you joining me and doing everything that you can. I appreciate it. And have a good night.
Aye.
Good night, everyone.
Neat.